Well, I just really appreciate what you and your clinicians, the value you guys add by coming out with us into homeless camps, into people in crisis, and help us not only understand what it is we're seeing, but be able to provide some perspective and some resources immediately right at the point of contact. I really appreciate that. We want to help these people get to where they need to be, for one thing, but the other thing is we want to keep our public lands, unobstructed and usable and so that we can remain, people can remain safe and confident in their safety, and they're out recreating, camping, riding, cycling, using our public waterways, that they could do that without having to be threatened by dogs or whatever. As much as we try to avoid it, there's still a little bit of a conflict relationship. Saying you can't be here, we're offering you some help, where you guys bring a different voice, you bring a different perspective, a different face, a different look, and you're able to make, build some rapport.
And our goal is to look at it multiple ways. We look at it not only from the resourcing perspective, which honestly is one of the easier pieces, looking at what they're identifying as their need that they haven't been able to identify, but then also looking at the in between the lines. Sometimes people are saying, we just need food, I just need a house, but what are the barriers to those? What stopped them from being housed on their own? Why are they struggling? And usually that's much deeper than that. And that's why the clinical team is so important, is they can look at it from those different perspectives. Is it mental health? Is it medication? Is it medical? Maybe it's logistics. Maybe it's just about getting a bus ticket, or just about getting connected to their family members again. Those are easy things for us to help them with that may take a couple of days, but over time we can help. Yeah,
the goal is not to fill our jail. The goal is not to just, push people down the road. That's not it. We wanted the human part of us wants to just put these people, with the right resources they need to help them get where they need to be in life, so they can go about their life.
We're also collecting data, which is super important to me, and I know to you, to start saying, what are the barriers that we don't have? Where's the systems in the community right now that we know we can't get people connected? Why is this becoming an issue? Where do we need to put money? Where do we need to put resources to build programs? Is it in law enforcement? Is it in mental health? Is it in community agencies that want to do the work but don't have the expansion dollars to do that? It's going to become a central team to what the county's mission is, which is really making sure that people are in the right place, getting the services that they need.
Yeah.